results of a study on breast cancer are expected to change treatment for thousands of women in the early stages of the disease. The study of more than 10,000 women found that many of them did not need chemotherapy to prevent the cancer from returning or spreading. Our Dr. David Agus leads the University of Southern California's Westside Cancer Center. He joins us from Los Angeles. Good morning, doctor.
Morning, Norah.
So 70% of women with early stage breast cancer may not need chemotherapy. Who specifically may benefit?
Yeah, this is exciting. These are women with a hormone receptor positive, estrogen receptor positive, and a marker called HER2 negative breast cancer. Historically, we've been doing this test, which looks at 21 genes that are turned on and turned off in the cancer. And many of them didn't need chemotherapy, and some of them did, but most fell in the middle. 65,000 women a year fell in this indeterminate region. And these women were heroes. They went into a clinical trial, the largest ever done in breast cancer, where half just got hormonal therapy and half were given chemotherapy and hormonal therapy. And what they showed is no benefit to chemotherapy in these women. So another 65,000 women a year will definitively not need chemotherapy for early breast cancer.
So who falls into the category? What determines whether you get it or you don't get it now?
So these are the most common subtype of breast cancer, estrogen receptor positive and HER2 negative. Now, after a biopsy or the cancer is taken out, this test will be done and these 21 genes looked at, and the doctor will be able to look down and tell you definitively you need chemotherapy, you'll benefit, or you won't. So it takes out that indecision and really allows a great communication between the patient and the doctor and the best outcome.
And so if you don't do chemotherapy, doctor, then what exactly are you doing and where are the potential side effects or risks of that?
So in these women, the estrogen receptor pathway is turned on, so they're giving a drug that blocks that pathway, either tamoxifen or what's called an aromatase inhibitor that blocks the production of estrogen. And there's side effects to it, joint aches and hot flashes, but certainly significantly less than chemotherapy. Some women will still need chemotherapy. Those are the ones that have a higher score on this test, and they'll benefit from chemotherapy, but many now won't.
Let me ask you, Dr. David Agus, is there, as an oncologist, is this common now, not common I should say, but it's growing that less cancers need chemotherapy?
I will answer this for you, Norah O'Donnell. Yeah, we're getting to be able to personalize treatment now. And so in the old days, we would just have a bucket, breast cancer, prostate cancer, lung cancer. Now we can look at the subtypes of cancer by looking at the genes and giving the right treatment to the right patient at the right time. And this is the promise of personalized medicine, and it's arrived.
All right, Dr. David Agus, thanks so much.
Very exciting.
Thank you.